Hello, my name is Diana Borrera and I'm the Pulmonary Rehab Coordinator at St. Luke's. In this video, I'm going to show you how to use a pulse oximeter at home. A pulse oximeter is a small device that clips onto your finger and measures the oxygen levels in your blood. It also gives you a readout of your heart rate, which shows how fast your heart is beating. These measurements show how well oxygen is being delivered in different parts of your body. Before you use your pulse oximeter, make sure that you are indoors and at rest. Your fingers should be clean and avoid using dark fingernail polish or artificial nails. First, you're gonna press the button on the pulse oximeter to turn it on. Then slide your index or middle finger into it with the display side facing towards you. Look for that red bar that is pulsing up for an accurate reading. Keep your hands still while it's reading. Keep the pulse ox on your finger about 30 seconds before taking any reading. Sometimes one reading is not enough to see the whole picture of your oxygen levels. When at home, check them twice, 12 minutes apart. Record your oxygen levels every 6 hours during the day, or about 3 times a day. You don't need to wake up in the middle of the night to check your oxygen levels. If you feel like your symptoms are getting worse, you can check your oxygen levels more often. Write down your results, the date and the time. If needed, follow your healthcare provider instructions for letting them know your results. If you have any questions, call your healthcare provider. Thank you for choosing St. Luke's for your healthcare needs.